Some healthcare workers in Gauteng are struggling to put food on the table. This follows the health department's failure to pay their salaries in April. And these are the employees who were hired to assist at the height of the COVID-19 pandemic. And now healthcare worker union Denosa wants officials to be held accountable. So to discuss this further, we're joined by Denosa's Bongani Mazibuko to explain to us what exactly happened, but also the impact this has had on healthcare workers. Mr. Mazibuko, thank you so much for making time for us this morning. I mean, I can't imagine going out without a month's worth of a salary in this economy, in this economic times. And I don't understand why it should be okay to expect someone else to go through the very same thing. Do you have an explanation from the Department of Health as to why some 1,000+ healthcare workers were not paid their April salaries?
Yeah, good morning and thanks for having us. It's totally unacceptable, and as you had said in your opening, that imagine in this current economic climate having to go a month without a salary. It has been quite a difficult time for the concerned employees, and the department in its explanation had said it was an administrative error, which we find unacceptable to say that to reduce this to an administrative error. To us, somebody somewhere did not do their job, and they need to be held accountable. And we are calling on the department to do so, and let there be consequence management. It cannot be acceptable that people are having to struggle for a whole month without their salaries, and then we just say it was an administrative error.
And also in terms of remedying it, as opposed to just giving, a response as to why it happened, did they act with a sense of emergency and urgency in terms of remedying the situation and making sure that these healthcare workers are paid?
There has been, because we have been in communication with them, we can confirm that we received a commitment from the department to say that all the employees that are concerned should be paid on or before the end of the month. And so we think that at least there was a sense of urgency there. But what we don't understand and what we want to hold the department accountable for is why did it have to come to this point? All these things that you are doing, you should have done already when you saw that there's a possibility of this coming. And I will take you back to what happened last year, where we ended up marching to the department and to the Premier's office because both community service workers were not paid, precisely because at that time it was because the CFO had not done her job, and we were calling for her suspension. And now we are doing the same thing again. It's a different category of workers, but somebody somewhere again failed to process information timelessly and make sure that employees' things are done, and then those employees will receive what is due to them. So it just means that somebody somewhere has been derelict in their duty, and we are calling for that particular person or people to be held to account and let there be consequence management again. You can't do this and then just say that it was an administrative error. People are the ones who are doing admin, so those people are the ones that we are calling for their heads to roll.
Yeah, if there seems to be a cycle here in terms of this not being the first time it's occurred, then definitely it's a point of negligence. Someone's not doing their job, and they're not getting, there are no repercussions or consequences for that action because it's a repetitive, sort of like action that's been taken here by the department. I want to talk about the healthcare workers themselves right now, Mr. Mazibuko. How have they survived this past month? How have they fared without their salary?
They've truly had to struggle. We've received people say complaints and challenges from people saying that they're struggling to get to work. Others were not even able to pay their rent, and others were saying that they did not pay school fees for their children. So they've had to make requests and make arrangements with their debtors and other people and so forth.
Oh, I seem to have lost you there, Mr. Mazibuko. I think I have you back.
Oh. Yes. I think it was a very difficult time for them throughout this whole process. So it's unfortunate that you are working, but you are not getting what is due to you. So it's been frustrating not only for us as the union to go through all this and trying to help the employees, but also to feel so helpless because you or yourself, there's not much that you can do other than fight with the department to make sure that you get a commitment for when the salaries will be paid. So it's a very difficult time, and the workers have been pulling their weight. And even though they did not get paid, but they've made sure that services are not disrupted. And that is such is the commitment of these workers to the department in making sure that the the health system in Gauteng does not collapse, even though they did not get paid.
Absolutely. Before I let you go, Mr. Mazibuko, I mean, how can we avoid such things from occurring once again? As a union representing your members as well, but also speaking on behalf of the many healthcare workers that obviously I can't speak to right now on this big platform, how do we sort of appeal to the department not to let this happen again? What can be done to assure that we prevent it from happening as opposed to talking about what happened and its impact on our workers?
I think it's a simple thing. Sometimes if somebody notices that if you do wrong, there's consequences for it. Right now, people are not being held accountable for their actions. And that purely is the only reason why we keep seeing these things happening repetitively. So until such time that the department and whoever else is in charge makes sure that people are held to account for the mistakes that they are doing, then we think that will be the start of the line to make sure that these things do not happen again.
Indeed, going back to consequence management, as you had emphasized earlier. Bongani Mazibuko, thank you so much for joining us right here on Newslink. Denosa's Bongani Mazibuko talking to us at the back of 1,000 plus, approximately. Those are health workers in Gauteng were not paid their April salaries by the Department of Health within the province, saying totally unacceptable. And I'm sure one has to agree that in these economic times, so at whatever time, especially when service has been granted, work has been conducted, that health workers need to be paid, playing quite a crucial role in making sure that systems do continue to roll in our healthcare system. So all my thanks to Bongani Mazibuko for that time.